Have you ever heard of the term catastrophic health expense? And did you know that catastrophic health expense pushes a large number of Indians below the poverty line? Any guesses for what this large number is? $1 million a year? Not even close. 10 million? Keep going on. 20 million? Stay tuned to find out. Hey folks, you're watching Niz.Madrasi. It's all about facts and current affairs. A channel for the common man by a common man, that's me, Niz. Here is a story of a 43-year-old farmer called Jasmeet Singh, who once owned a piece of farmland in Punjab's Amritsar district. He was forced to sell the land to pay for his father's cancer treatment at a private hospital in Delhi after a brief period at a local government hospital. He did not have a choice. Amritsar Hospital's cancer unit did not have facilities to treat his 64-year-old father. Singh is among millions of Indians forced to turn to highly expensive private healthcare because of lack of quality medical services in public institutions across the country. Healthcare costs have spiraled so much over the past few years, especially for diseases like cancer. They sometimes wipe out entire life savings or even force people to sell their homes. In lower and middle income countries, this high out-of-pocket expense, also known as catastrophic health expense, ends up pushing millions of people below the poverty line. In India, 100 million are pushed into poverty every year because of this catastrophic health expense. This certainly cannot be a good thing when we are trying to eradicate poverty in this country. So it looks like it's not just education or jobs that will reduce poverty levels in a country. Focus needs to be given to healthcare too. Every country needs a robust health system in place. The money that a country spends on healthcare falls into three categories: government spending, insurance coverage, private spending, otherwise known as out-of-pocket expense. So which of these do you think should be high and which ones should be low for a country to avoid catastrophic health expense and thereby preventing more of its population from falling into poverty? That's right. Government spending should be high. Insurance coverage should also be high, and private spending, at least for the poorer sections, should be low. Apart from providing quality and quick healthcare, this is exactly what the fundamental function of a country's healthcare system should be. That is, to put in place a health financing system that protects the population against the financial risks like catastrophic health expense associated with ill health. But do you know what percentage of healthcare spending in India comes from out-of-pocket private spending? 64.6%, which means that if India spends 100 rupees on healthcare, 65 rupees comes from our pockets, the citizens' pockets. That is a huge number, and it puts us at 15th rank in a list of 232 countries, territories and regions worldwide. That's not a good thing. And among the top 10 economies in the world, India, which is ranked 5th based on GDP, ranks the highest when it comes to percentage of out-of-pocket private spending. You can see for yourself that France is best placed at 9.6%, the US is at 11.1%, China and Brazil, India's BRICS partners, are a bit high at 36% and 43.6% respectively, but still nowhere close to India's 64.6%. No wonder 100 million Indians are pushed below poverty levels annually. So how do we reduce out-of-pocket private spending? By increasing insurance coverage and government spending. Let's now look at where India stands when it comes to the percentage of population that has health insurance coverage. India has made some progress in this regard. In 2010, only about 20 to 25% of India's population had health insurance coverage. A report from 2017-18 shows that this number has grown to approximately 44%, which means that 56% Indians still do not have any form of health insurance coverage. Two factors have led to this increase. Number one, between 2013 and 2017, standalone health insurers gained substantial presence in the retail segment, which led to increased coverage in the middle and high income groups. Number two, government's National Health Insurance Program, Rashtriya Swasthya Bima Yojana, launched in 2007, which later got subsumed in 2018 by Ayushman Bharat's Pradhan Mantri Jan Arogya Yojana, PMJ for short, has expanded coverage to the nation's poor as well. Based on the deprivation and occupational criteria of the socio-economic caste census 2011, the bottom 40% of the poor and vulnerable population is eligible for PMJ coverage. In absolute numbers, this is close to 100.74 million households, or roughly 500 million Indians. If the government manages to bring all 500 million under the umbrella of PMJ, it would be a huge step forward to achieving 100% enrollment. We are still far away from providing universal health insurance coverage, which happens to be one of United Nations Sustainable Development Goal. While insurance coverage is one aspect, the government also needs to pay attention to improving government and government-aided health institutions like primary healthcare centers, general hospitals, specialty clinics and hospitals. While some states like Kerala and Tamil Nadu have done exceedingly well in this regard, the story is not so great for most of the other states. Quality of healthcare providers and services is a big challenge. Here is an example. In rural Madhya Pradesh, 67% of healthcare providers who were sampled reported no medical qualifications at all. Availability and access to government health institutions is another challenge. In many states, the growth in healthcare infrastructure has not kept pace with the increase in population. Thus, it's no wonder that 79% of urban India and 72% of rural India prefers treatment at private hospitals than government ones. There is a reason for this, and it's quite alarming. Did you know that while India and Indians spend close to 3.7% of the GDP on healthcare, Government of India's share in the spend is a minuscule 0.9% of the GDP, not even a full 1%. This puts us at a pretty bad 160th rank among a list of 200 countries. Again, for a country that is the 5th largest economy in the world, being so low ranked when it comes to government spend in healthcare is completely unacceptable. The United States, the largest economy, is also the top ranked when it comes to government healthcare spending, a whopping 14% of its GDP. Japan, Canada and leading European economies have higher ranks thanks to their government healthcare spend being around 6 to 10%. BRICS countries, Brazil and China too have their work cut out as they are low ranked too, 3.9 and 2.9% respectively. They are still quite high compared to India. The signs are clear. The government of India has to invest a lot more to provide quality, quick and cheap healthcare to Indians. The government spending should increase to at least 8 to 10% of GDP in the next few years. This will go a long way in preventing catastrophic health expense, which will help reduce poverty numbers. We really don't want to push 100 million Indians towards poverty each year. So I guess a wealthy India is possible only when the government invests in a healthy India. Niz.Madrasi aims to create a platform for healthy, educated and civil discussions while hopefully learning something new. If you think you're up for it, please go ahead, like, comment and share this video and subscribe to Niz.Madrasi on Facebook, Instagram, Twitter and YouTube. That's it for now. Take care until we meet again. Stay home and stay safe guys. Vanakkam and cheers.